Penguin Random House Audio presents The Angel and the Assassin, the Tiny Brain Cell That Changed the Course of Medicine, by Donna Jackson Nakazawa. Read for you by Melinda Wade. For Claire. This is a work of nonfiction. To protect the privacy of others, certain names have been changed, characters conflated, and incidents condensed. In many cases, I discuss research in terms of dates and time periods during which the research was or is being conducted, rather than the date it was published. In addition, several scientific discoveries I report on were made around the same time, but because I move back and forth between stories, I present some of them sequentially. This audiobook is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition or treatment. Prologue. When the body attacks the brain. My interest in the mystery surrounding the link between physical disease, the immune system, and brain-based disorders began more than a decade ago, when I developed a rare autoimmune disease that left me unable to walk. Over the course of a 5-year span, between 2001 and 2006, I spent, all told, a year in bed or in a wheelchair. Listeners of my previous work may be familiar with my story. If so, forgive any brief repetition here. My doctor, a neuroscientist at Johns Hopkins, was studying my disease, Guillain-Barré syndrome. My case was unusual in that I had been felled and paralyzed not once, but twice by the disease, rare but not entirely unheard of. My doctor, who knew I was a science journalist, and I talked at length about what was happening repeatedly to my body and how he hoped to reverse my paralysis. He explained that in my disorder, as in all autoimmune diseases, my immune system's white blood cells were behaving erratically, like an army gone rogue. Instead of judiciously protecting my body from invading pathogens, my white blood cells were mistakenly attacking and destroying the protective myelin sheaths that coated my body's nerves, causing the nerve-muscle interconnections that I needed to stand and walk, or simply wriggle my feet to go dark. I began to think of these overactive immune cells as being like Pac-Man, those 1980s video game characters, crazily gobbling up and destroying my good nerve cells, eating away at the crucial nerve connections that made my physical body mine, strong, capable, dependable me. Regular intravenous therapies would, my neurologist hoped, reboot my immune system so that my white blood cells would stop overreacting and behave normally. If this approach worked, and we could get my overvigilant immune cells to back off from their attack, my nerves would hopefully start to regenerate on their own. The nerves that had gone dark would light up again, regrowing enough neuromuscular connections that I might even be able to walk once more. Many months later, it would turn out that my neurologist was right. In the end, my immune system's overexcited cells did back off. I did get much better. Not all of my nerves regenerated, but enough did so that I could walk again. And the significant gains I made have allowed me to live a good life. The human body can be miraculous that way. I had one question for my medical team during that time, however, that they could not answer. After losing the use of my legs, I'd also experienced what seemed to be some distinct and disquieting cognitive changes. For one thing, although I'd always been pretty even-keeled, I found myself facing a black dog depression. The feeling was at times so oppressive that when I read Harry Potter aloud to my young children, I felt as if I'd been attacked by the Dementors, those dark, sky-drifting ghouls who introduce a cloud of despair that steals a human being's happy thoughts and replaces them with bad ones. It almost seemed, I told my primary care physician, like someone had inhabited my brain. I'd also had a stellar memory and could recall conversations that had taken place weeks, months, even years earlier, word for word. Now, though, I was having to write simple things down, such as what time the physical therapist was coming the next day. No big deal, I thought. That's new for me, but it happens to lots of people. But there were other, more worrisome glitches. It was, for instance, taking me a disturbingly long time to recall the names of people I'd lived with and loved all my life. At Thanksgiving dinner in 2005, when I'd graduated from being bedridden to getting around, albeit in a limited fashion, with a walker or cane, it became a source of good-natured amusement for my extended family to watch me struggle to come up with a person's name. Everyone smiled patiently as I called out a string of names across our long table, one after the other, until I landed on the right one. Sam, Christian, Zen, Don, Jay, Cody. The dog's name, Chip. Could you please pass the salt? Even that could be seen, I told myself, as almost humorous. At least my brain was able to distinguish between male and female names. But some things weren't at all funny. My 6-year-old daughter would ask for help with simple first-grade math, and I found my brain stuttering just to add 7 and 8. Or I'd reach down to tie her shoes, something I'd done for years, and find myself staring dumbly at the laces, struggling to remember how exactly it was done. I can still recall cutting up slices of watermelon, putting them in a bowl, and staring down, thinking, "What is this again?" I knew, but I could not remember the word. I'd cover my lapse by bringing the bowl to the table and waiting for my children to call out, "Yay, watermelon!" And I'd think, yes, watermelon, of course it is. My rife anxiety was less surprising, given that I'd been plunged practically overnight into almost complete physical paralysis and hospitalized for several weeks at a time, more than once. In the process, as my body's nerves had demyelinated, I'd endured excruciating muscle spasms and undergone repeated spinal tap and electrical conduction tests, in which technicians shocked nerves in my arms and legs to see which ones were not responding. For a time, I'd lost use of the muscles needed to swallow solids. In the hospital, I'd blacked out after an allergic reaction to an IV therapy and come back to consciousness to find a team of ashen-faced doctors hovering over me with a crash cart, and a nurse uttering prayers under her breath. And then there were the endless weeks I'd spent in physical rehabilitation centers, learning to balance myself and push a walker across a room on numb legs that were nevertheless riddled with shooting pains. But this omnipresent anxiety felt like a separate disease in and of itself. My memory, clarity of mind, word recall were different. My brain did not feel like my own. I sometimes commiserated on the phone with a friend of mine, Lila, who had Crohn's disease and was having similar cognitive concerns. She told me that one day when she dropped off her older son at kindergarten, she'd left her 2-year-old son. He clambered down out of her arms to play at the sand table while she chatted with the teacher. In the classroom, too, by mistake. The teacher had followed her out of the class, with the toddler shrieking in her arms. "I forgot my own son," Lila said, sobbing. Her doctor had sent her to a psychiatrist, who was prescribing antidepressants for anxiety and obsessive-compulsive disorder, and Ritalin for ADD. But she wept, "I never needed Zoloft or Ritalin before I had Crohn's." I empathized with Lila. Her concerns mirrored my own. The next time I saw my primary care physician, I confided to her, "It's like a part of my brain has gone dark, too, along with my legs and feet." It reminded me of people I'd known who'd had a mini-stroke. "What's going on with that?" I asked, hoping to learn more about my own situation. I had not had a mini-stroke, my internist assured me. She reminded me that my life had been much changed, and what had happened to me had been traumatic. It made sense that my mental state would be deeply affected. My neurologist, meanwhile, encouraged me cheered me on in my recovery.
Sample complete. Ready to continue?